Yeah, as Brenda mentioned, the school year is set to start in less than a month for families here, and childhood vaccination rates are still at levels that make it unlikely a single infection will spark a disease cluster or worse. But there are consequences. For more on that and what the federal cuts mean for the future of vaccines, I'm joined by Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation and former acting director of the CDC. Dr. Besser, welcome. Really interested to get your insight here. We have this troubling decline in childhood vaccination rates. Then we have this proposal from the federal government slashing about $500 million in research for mRNA vaccines. Would you expect that a proposal like that will accelerate the trend that we're seeing with children? What will the practical impact be there?
You know, Brianna, I think that both of these will contribute to a situation in which more people are at risk from diseases that are preventable with vaccination. You know, I'm a general pediatrician. I practiced for more than 30 years, and I know that there was nothing I did for my patients that had more proven value than getting them vaccinated fully and on time. And that took spending a lot of time with parents, answering their questions, making sure they felt comfortable. But we currently have a Secretary of Health who is a leading anti-vaccine proponent. And what we're seeing in terms of vaccination rates for kindergartners doesn't even take into account the changes that he has put in place. Thankfully, the vast majority of parents are getting their children vaccinated. In New Jersey, it's over 95% are vaccinated fully. But the percentage of parents who are asking to be let out of the requirements for vaccination is slowly creeping up. And the reason that's so concerning is that for some of these infections, something like measles, if in your child's classroom you don't have just about every child vaccinated, there's an entryway for that disease to come in. And while only 5% of children in New Jersey are not vaccinated for kindergarten, they tend to group together. So I would suspect that there are classrooms where it's higher, where it's 10%. In some states, you see rates like this where in a classroom, maybe a quarter or a half of the children are unvaccinated. That's what's happening in Texas right now, where measles is spreading.
Yeah, I do wonder about those real-world consequences. You mentioned Texas, of an outbreak, but we have seen isolated cases right here in New Jersey where our rates are good, as you say.
Yeah, you know, they're good, but they're not good enough. And when you have someone in a position of power who is spreading ideas about vaccines not being safe, that's concerning. You know, the diseases that we are working to prevent, some of these I saw early in my career as a pediatrician, different types of meningitis that would be devastating for a family. We just don't see anymore. And I hate to think that we're going to have to see some of these diseases come back before the tide turns and the story turns in terms of the incredible value that vaccines provide. The cut in the research that the Secretary just announced will leave us at greater risk the next time we have a pandemic. And I can't tell you what the next pandemic will be, but I can tell you that one day there will be another pandemic and we will be less prepared because of these massive cuts to research.
You mentioned some of the science that the Health and Human Services Secretary has been talking about. He has said that the mRNA vaccines in particular don't perform well. They're essentially ineffective. What does the science say, Dr. Besser?
Yeah, I mean, he is telling falsehoods. That's just not true. The COVID vaccine was the first mRNA vaccine that we've ever used. It allowed us to have safe and effective vaccines faster than ever before. Within a year, we had many vaccines. Normally, it would take 2 or 3 years. Those vaccines saved millions of people. They were safe. They were effective. They've been developed. The work on those have been going on for more than 20 years with government funding. And it was absolutely miraculous. And now to take that tool away is going to put millions and millions of people at risk the next time we have a pandemic.
What is your message, especially to parents who may be on the fence, given the mixed information, the confusion out there, who may be on the fence about getting their child vaccinated, and what do they need to know heading into the school year?
You know, what they need to know is that the vaccination rate that matters the most is the vaccination for your child. And there's nothing you can do that will protect your child more than ensuring they're fully vaccinated and on time. But I would also ask the question at your school. What is the vaccine coverage in your school, in your child's classroom? Because that is an issue. And it's very important that your child, when they go to school, is protected for themselves. But also when you vaccinate your child, you provide protection to children in your school who may have medical conditions that don't allow them to get vaccinated. Children with cancer or immune problems. You provide protection for your child and for your child's classmates and for the community. It's a wonderful thing that you can do.
Dr. Rich Besser, thanks for shedding some light on this. Good to talk to you.
Nice talking to you as well. Thank you.